Previous research on the effects of COVID-19 found it linked to heart attack, heart failure, brain fog, diabetes, and gastrointestinal issues.
Wow, but researchers have now found more dangerous links to mental health, especially if the patient is unvaccinated. TV5's Colette Boyd has the details.
When you think of the effects of COVID-19 or long COVID, you think of this.
So it's really the neurologic manifestations that we've been able to characterize following SARS-CoV-2 infection that fall under the umbrella of long COVID are much wider in scope than just brain fog that most people talk about.
Studies found that people who had COVID are much more likely to have incidents of depression, anxiety, sleep disorders, opioid use disorders, and other substance abuse disorders. But do vaccines help?
Vaccine reduces the risk, but does not eliminate the risk of these manifestations.
Unvaccinated people who were hospitalized due to COVID were over 15 times more likely to have an incident of depression compared to over 12 times for vaccinated hospitalized people.
You can think of it as when the tsunami hits and the water recedes, or when the earthquake stops, or the earth stops shaking, you're going to be left with the damage.
It is each person's choice, but they need to be aware of the risks when they make that choice. I'm Colette Boyd reporting.
Dr. Al Ali has another new study on the effect of long COVID on every organ system years later.
He found that the risk of death was no longer present in non-hospitalized COVID-19 patients 3 years after infection, but the risk of death did remain elevated after 3 years for those who were in the hospital.